Hi, I'm Justina, and I will be doing a peritoneal dialysis catheter implantation dressing. And that's when the catheter is placed through the abdomen, and waste and toxins are taken out of the body for a patient that's going to go on peritoneal dialysis. The PD catheter is usually placed in the abdomen, but also can be placed in the chest or the sternum. But I'm going to be doing the abdomen today. The exit site is typically placed on the left or right side of the belly button. But when they check for where they're going to put it, like how high, they usually mark the patient when they're dressed, and then so they can see where the belt line is. So then that helps the surgeon to make sure it's not going to be the exit is not going to be obstructed by their clothing. Of course, before surgery, you're going to perform your hand hygiene, put on gloves. I have gloves, but when I was trying to practice, I was having a really hard time with the tape. But yeah, so usually I'd have gloves on. But each dressing could be different depending on the what's it called, the healthcare professional, because of the patient's skin condition or the amount of drainage that's coming out. But I'm going to be using a pillow as the abdomen. We'll say the left side. And I am using what is this? A nasal O2 cannula. Yes. Cannula for the PD catheter, and I shoved it in a zippered pillow, but I just try to use tape to close the other side. So I put it in excuse this thing. I put it in there so it kind of makes it look like it's really coming out of the pillow. And then, so I actually have some non-woven gauze sponges, and then as my wound cleaner, which could be a saline or sterile water, because it's just cleaning the outside of any type of blood or tissue or anything. What's it called? But it's wound cleaner, so that's what I'm going to use. And then I actually have some surgical tape, and I'm going to be using paper towels as the bigger dressings, the sponges, or bigger sponges, or like the abdomen dressing. So yeah. So first I am going to, let's see. Use my sponge clamp, and then I'm going to spray. Then I'm going to go around the exit wound, and I'm just going to pat and not rub, so I'm not irritating the skin. And then I'm going to take a non-wet one, a dry sponge, and I'm going to dry around to get the excess moisture off. And then I'm going to use two 4x4 drain sponges. These have a cut in them, and it's supposed to be kind of like a cross shape in the center, because this helps to go around where the drain is, and then allowing it to fit around snugly. But the reason I'm gonna use two, because I'm gonna put one in one direction. So where the opening is that's where I'm gonna put it in the opposite direction. And this is so that, if you just put one, if there was like skin exposure or anything, it's all covered. So I have 2, and it also helps, you know, let this be exposed and stay exposed. So during the surgery, or after the surgery, sorry, once the catheter is out, you're gonna wrap it. I've seen where some tape it, and some just like leave it and try to just place sponges over it and then tape. But I'm gonna do the tape method first. So I'm gonna use the silk tape. Sorry, I got another one. I'm gonna use silk tape, and that one is mostly commonly used because it's the adhesive tape. It's also hyperallergenic. It is gonna leave a residue, but we want to make sure that the what's it called, the tube's not going anywhere, or the catheter is not going to go anywhere. So I'm gonna place, and then we're gonna do kind of like a wrap around. So it's like this. And then I'm going to take my larger sponges and I'm going to create another layer. And the reason I'm going to do that is because I want to cover the actual catheter. So, and then it doesn't get messed up or snagged by any type of clothing, or when someone's moving, it's not going to move around, because this has to stay still for 7 to 10 days because the exit site needs to be left alone. So we got to make sure it doesn't move. So I'm going to put 2 larger sponges. And then I'm going to take, what's it called? My fabric tape. It is, what's it called? A porous and non-absorbent fabric. And it's going to secure the dressing, tube, and cannulas. What's it called? It also helps the skin breathe, and that's helpful if they're not going to be getting it wet and too much, or what's it called? Help the skin breathe for that 7 to 10 days, because it's not going to go anywhere. All right, so there's 1. So, in surgery, the surgeries that I was doing research on, there was few where they only did the ends, and then I've seen it where they just stripped a lot of tape over the whole thing. I would strip it over the whole thing, but I don't want to waste this type of tape. So I'm going to do the ends. Oh no. Oh, I just ruined it. All right. So I'm going to do it on all 4 sides. But if I had a bunch of this, I would place it over the whole thing. So now I have the 2 layers of the drain sponge. The tape is the silk tape is helping the wrapped up catheter to stay in place, so it's not moving inside of the in the dressing. And then I have the pad. It could be sponges, like multiple sponges, or it could be an actual abdomen tape, which are those really long, big abdomen tapes. So there you go. That is my peritoneal implant dressing. Thank you very much.